Welcome to the general examination of the patient. The general examination of the patient consists of three main points. First is the general appearance. So the general examination first is the general appearance. The general appearance consists of the following. A. Age group. Age group. Neonates, 2 months. Infant, up to 2 years. Children, teenage, young adult, adult, mid-adult, and old age. These are the age groups. B is the sex of the patient, male or female. C is the consciousness. Is the patient is conscious, unconscious, drowsy, and so on. Oriented, not oriented. D, attitude. Sitting position, supine, prone, standing, and so on. E, speech. Regular speech or dysarthria or unable to speak. The speak is important for us, especially in post-operative after thyroidectomy. We want to check whether we have injured the recurrent laryngeal nerve from surgery. The patient will have hoarseness of the voice. Emotional state. Emotional state means is the patient in pain or the patient is comfortable. G is the nutritional state of the patient. Is the patient is obese, malnourished, nutritional state. H, gait. The gait of the patient can give us clue to the diagnosis of his condition. In certain conditions, poliomyelitis or foot drop or bilateral dislocation of the hip, each one will have a special gait. The last thing is accessories. The accessories include the following. If the patient has wound, dressing, you should mention where's the wound, dressing in the abdomen, and you have also to mention whether the dressing is wet or it is dry, the surroundings, inflammation, and the dressing means what type of operation, what type of incision. From the dressing you can know the type of incision. dressings, for instance, in the lower abdomen, could be related to cesarean section, for example. Whether the patient has drain tube. This tube put in the abdominal cavity or around the abdominal wall to evacuate abnormally collected fluid or blood. Cannula. Cannula, you should mention the side of the cannula, what vein, in the dorsum of the hand or in the forearm, what type of vein, cephalic, basilic vein, the color of the cannula, the size of the cannula, and whether it is connected to giving set, IV fluid, type of IV fluid, rate of drops, all of this, or it is connected to drugs such as paracetamol or flagyl bottles, and so on. Catheter. Urinary catheter, Foley catheter, connected to collecting urine bag, amount of urine, and so on. Chest tube. Chest tube usually connected to underwater seal system, or the patient might have a plaster of Paris, we call it POP, for fractures. And you should also mention where is that plaster of Paris, in the forearm, in the arm, in the lower limb, and for what type of fracture. So these are the general appearance of the patient. The second, after you finish describing the general appearance, after the general appearance, we have what is called the specific signs. Second, specific sign. What are these specific signs? A, for anemia. We should look for anemia in the general appearance of the patient. He looks pale, in the conjunctiva of the lower eyelid, in the undersurface of the tongue, and in the palmar crease, and in the nail bed. These are signs of anemia. B, jaundice. Jaundice is yellowish discoloration of the skin and the mucous membrane. You should look for jaundice in the sclera of the eye, and examine the patients on the daylight. C, cyanosis. Cyanosis could be central cyanosis in the tip of the tongue and in the lips, or peripheral cyanosis at the tip of the fingers, peripheral cyanosis. D, clumping of finger. Clumping of fingers. The clumping of fingers, you hands, and you can see there is what is called the Shamroff window. Shamroff window. If it is absent, it means there is a clumping of the of the finger. Of course, the clapping regrades. The last or the advanced state of clapping of fingers is the drumstick of the finger. Drumstick becomes similar to the stick of the drum. Drumstick, more obvious. That stage of clapping of the finger. The oedema. The oedema, you can see it in the leg, above the medial malleolus. You press against the tibia for 1 minute, and you can see whether there is a fingerprint after you remove your finger, whether there is fingerprint on the skin. It means this is pitting oedema. And also can be checked in the presacral region at the back. If dehydration of course the tissue turgor will be lost. We just pinch the skin and you can see whether it is returned normal or it delays. And lymphadenopathy. Lymphadenopathy, whether it is obvious in some patients, cervical region, and in the axillary region, and in the inguinal region, in a specific signs. Anemia, jaundice, cyanosis, clumping, oedema, dehydration, and lymphadenopathy. The third point in the examination, the third is the vital signs. Vital signs. Vital signs are the pulse rate, B, blood pressure, C, respiratory rate, and the temperature. Of course, in the pulse rate, you should check 3 fingers, the radial pulse for the rate of the pulse, regularity of the pulse, and volume of the pulse, and the state of the arteries. You can check it by 3 fingers. 1 is pressing and 2 for watching. The blood pressure, of course, by sphygmomanometer. The respiratory rate, you should have a watch, and notice the rate of the respiration over 1 minute. Usually it's about, for the average, 14 to 16 per minute. Temperature of the patient, you can check it either by sublingual or axillary or rectal. So these are the vital signs, and these are 3 main points in the general examination of the patient. We started with the general appearance, and then to specific signs, and then to the vital signs. Hope this was clear for you. Any questions, you can send it through the classroom, and thank you.